Hi, and welcome to this brief presentation assessing the food environment of Sarasota County. The focus of this assessment is how the Sarasota's community may be experiencing a public health phenomenon called the double burden of malnutrition. I'm Jordan Colbert, a public health and dietetics student at the University of North Carolina, Gilling School of Global Public Health, and I thank you for your time today. Before defining the double burden of malnutrition, it is helpful to revisit the basics of malnutrition. Common causes of malnutrition include chronic illness, such as cancer or COPD, environmental factors like extreme weather or inadequate food access, starvation, the prolonged inability to consume nutrients, or mechanical causes such as disability. Malnutrition is an umbrella term referring to inadequate nutrition that results in either undernutrition or overnutrition. Most discussions focus on undernutrition, low body weight, nutrient deficiencies, muscle wasting in the elderly, stunted growth in children, and starvation among people in poverty. Overnutrition can be equally devastating to health, as excessive intakes of nutrient-poor foods can promote the development of chronic diseases like atherosclerosis, type 2 diabetes, and obesity. Often, conversations around malnutrition in the dietetic sphere are focused on the individual level. For the duration of this presentation, I'd like to invite you to try on a particular perspective when discussing malnutrition. Let's refer to the quote written on the slide. Malnutrition, whether under or overnutrition, has an important common denominator: food systems that fail to provide all people with healthy, safe, affordable, and sustainable diets. From this perspective, we can discuss malnutrition at the systems level and better understand the impact of inadequate food access on both communities and individuals. Both forms of malnutrition, undernutrition, and overnutrition are important public health issues, but what happens when undernutrition and overnutrition occur at the same time? Researchers are referring to this intersection as the double burden of malnutrition. Now, a more exhaustive overview of the double burden of malnutrition is beyond the scope of this presentation. A great resource to follow this global burden is the World Health Organization. This webpage and fascinating research published in the Lancet Journal will be listed in the references section for further review. For this presentation, let's simply get a handle on what the expression really means. The double burden of malnutrition is characterized by the coexistence of undernutrition along with overweight, obesity, or diet-related non-communicable diseases. This can occur at the individual level, the family, neighborhood, or community level. My hypothesis was that areas with overlap in undernutrition and overnutrition would be found in locations with higher levels of food insecurity. As a quick overview, food insecurity is most properly defined as a lack of consistent access to enough food for every person in the household to live an active and healthy life. Food insecurity is traditionally thought of as a struggle with getting enough food. However, food insecurity can also manifest as low access to high quality foods or lack of food variety. This can be a temporary situation or it can last a long time, but most often food insecurity appears in areas with higher levels of poverty. So back to the primary question of this food environment assessment. Is there evidence of the double burden of malnutrition in Sarasota County? To answer this question, I identified what I'll call indicators for both undernutrition and overnutrition. Ideally, these indicators would have included statistics on starvation or prevalence of obesity. However, this data was not clearly available at the population level needed for this presentation. In an attempt to collect meaningful data, I chose the indicators shown on this slide. To capture undernutrition in the community, I identified prevalence of nutritional deficiencies in infants with very low birth weights. To capture overnutrition in the community, I assessed prevalence of heart disease and prevalence of diabetes. The goal was to find out where these indicators overlapped in the community. I performed a statistical analysis at the census tract level. So where do these indicators overlap in the community? I created this map to provide an overview of poverty in Sarasota County. For the scope of this presentation, I limited the map's reach to show approximately 5 miles radius from Sarasota Memorial Hospital main campus, represented by the red plus sign. Orange shading indicates census tracts where greater than 20% of the population lives in poverty. The red asterisks signify Sarasota Memorial Hospital locations within the community. We will now zoom into the heavy concentration of poverty in the upper region of this map. The numbers on this map identify the respective census tracts of the area. This table summarizes my findings. The columns indicate the census tract numbers shown in the map on the previous slide. The rows correlate to indicators of either overnutrition or undernutrition. A check mark indicates that the census tract falls within an upper quartile for the corresponding indicator. Let's take census tract 11.02, the rightmost column, as an example. The residents in this community face a relatively higher prevalence of heart disease and diabetes deaths, as well as deaths from nutritional deficiencies and infants with very low birth weights. In other words, both indicators for overnutrition and for undernutrition were highly prevalent among this population. As we zoom in closer to view census tract 11.02, we can assess the food environment. Here I mapped locations available for purchasing food. This census tract hugs the Newtown neighborhood in the north central Sarasota area, and its centermost point is situated at the intersection of Tuttle Avenue and Dr. Martin Luther King Way. A quick glance at the icons on this map reveals that there are not many food options within the community. There's one supermarket at the lower right corner of the map and one restaurant. There are also 2 pizza places, a taqueria, corner store, and a dollar store within the limits of this community. Just on the outskirts of the community on North Washington Boulevard, there is another corner store and another dollar store. Through the lens of food insecurity, there is clearly reduced access to food quality and variety in this community. Prepared food options outweigh fresh food significantly. The quantity of food choices available in this community is also limited. While it may seem like that lower right corner of the map hosts many food options, this location is greater than half a mile from most of the residents in the community, making it unsuitable walking distance for food. For part of this assignment, I completed a food retail assessment known as the NIMS assessment, and I selected the Key Food Fresh supermarket, which is the only grocery store within a half mile of the census tract. This store likely serves nearby residents within walking distance. I say this because when I arrived, the parking lot was not very full, and I observed that many people were walking or riding bikes for transportation. Notably, most of the signage, conversation, and music in the supermarket was in Spanish. In fact, as I was completing my assessment, the store manager approached me and spoke to me in Spanish. I was able to explain to him my assignment and received his blessing to carry on. The following 2 slides summarize the retail assessment. I chose to look into produce options as the first theme. Dependable access to fruits and nutrition, fruits and vegetables is essential for prevention of both under and overnutrition. The store did an excellent job of providing a wide variety of fruits and vegetables. Immediately upon entering the store, the produce section was visible, brightly lit, and inviting. For the produce options that were not available, like peaches, a plethora of other options were offered, including papaya, mamey, and plantain. The second theme of focus in this assessment was frozen dinners. Items like chicken fingers and frozen pizzas were excluded from the assessment. The supermarket had very limited space dedicated to frozen dinners. The freezer pictured shows all available options, and the red box on this picture highlights the selection of healthy alternatives in the frozen dinner section that were available. Only 2 choices were available that came in low sodium or low fat forms. Reflecting on the food environment of this community, gaps include lack of walkable, healthy food options in the census tract. The most prominent food that was available was pizza. Strengths include access to cultural foods. Over 30% of this community is Hispanic or Latino, and the nearest grocery store definitely serves this population. The potential impacts of COVID-19. COVID-19 has increased the burden of bringing food to the table for families in general. Also, there were many empty retail locations in the supermarket plaza. This maybe reflects the economic burden that COVID-19 has had on businesses in recent years, yet it's also a potential opportunity for new health-oriented businesses to take place in the future. This slide features a causal loop diagram exploring the relationship between food insecurity and malnutrition. The causal loop diagram helps us see how interrelated food insecurity and malnutrition can be. Factors like food access, medical expenses, nutrition choices, and health status are deeply interwoven. This interconnection reminds us of the importance of collaboration when working with patients, as addressing any one issue on its own will likely be reductionistic and not meet the patient's needs. In summary, the double burden of malnutrition is still a relatively new term. In its most appropriate use, it refers to the phenomenon of overnutrition occurring among populations that historically have experienced undernutrition. As the US is a high-income country, we should be mindful of how we use this term in local research. The double burden of malnutrition can be found in nooks of the US where there is greater poverty and food insecurity. An example of this community in Sarasota County includes Census Tract 11.02. These residents appear to be at an increased risk for malnutrition in all of its forms. Sarasota Memorial Healthcare Systems is already taking steps to address food insecurity in the community. One project this hospital has taken on is a collaboration with All Faiths Food Bank, the local food bank, to complete food insecurity screenings with patients in certain departments, including the mother-baby unit, and providing emergency food boxes, and also sending these patients as referrals to the food bank if they screen positive for food insecurity. Sarasota Memorial Hospital also has an affiliate clinic in Newtown. This location is crucial in serving these communities that are facing financial and health inequities in our county. But what else can we do? Recent data suggests that 1 in 10 people in the Sarasota County live with food insecurity. My suggestions for next steps would be first to expand the emergency food box program with All Faiths Food Bank. I suggest beginning with between 1 and 3 additional units at SMH Main. Order for the food boxes can be placed with supply chain for patient to receive the food box upon discharge. My contacts at the food bank confirm that they have the capacity to increase the frequency of deliveries of these food boxes if they start moving faster. With these steps, there could be a possibility in the future of even designing custom food RX boxes with All Faiths Food Bank, depending on patient diagnoses. A second suggestion would be to begin using the Hunger Vital Sign, which is the food insecurity survey with all patients. This is a big mission. My suggestion is to test a single area like the emergency room. Another suggestion is to incorporate the survey and checkbox form into the ADIME note for RDs. This would be very easy and natural questions to weave into the RD assessment. If you're interested in learning more about these types of efforts, I suggest looking at Baycare Health Systems collaboration with Feeding Tampa Bay for inspiration. I have referenced a link in the references section. Thank you for your attention, and please contact me with any questions. This is only a glimpse into a much greater conversation, and I'm excited to see how SMH can continue to serve patients at risk of food insecurity.